I came into NDSU in 1998 and to run the annual giving program for the foundation. And one of the things that we were doing was helping raise dollars for each of the academic colleges. And that was the first time I met Chuck, was sitting down with him and talking about what's our case for support and the kinds of things that we want to do to encourage alumni and friends to support his college at that time. And what I remember about him then, and still do today, was somebody that was innovative, wanted to try new things, very interested in engaging with the external community. And so that was my first introduction to Chuck. He was just always mindful of the importance of I think our alumni and the ways that they could help advance excellence in the program. And again, dream partner for somebody that's in the business that we're in, which is all about building relationships with our alumni and friends. But certainly the Aldebaran Tower project is going to stand out. I mean, major capital project, working with a number of alumni and friends and companies to get involved. It was all privately funded, and we met weekly, we had late night conversations, and it was just a success. Man, we're gonna miss you. So and thank you for the impact you've made on so many lives, and those behind us, those ahead of us, and for your friendship. And I know that doesn't go away, but thank you.
So if I were to describe Dean Peterson with 3 words, I think they would be humble, integrity, and trustworthy. He's just always been an iconic leader. He has been visionary. He motivates and inspires others. What he lives by is to do the right thing, and you can see that woven through all aspects of his life as a leader and with his family. What I'll remember most about my accomplishments with Dean Peterson is that he just stood by me through thick and thin. He always had my back. So he was behind me all the way when we expanded the pre-licensure BSN program, when we rolled out the RN to BSN program, and when we acquired Sanford College of Nursing in Bismarck. He just was always at my side and gave me full support. And he's always been a mentor to me. Whatever you do, just be Carla. We just want you to be Carla. Your most important job is to provide people with the support and resources they need to be successful, and then just get out of their way.
So I think the strengths that I see for Dean Peterson, number 1 is humble. Doesn't look for accolades of his own. He's very resilient, as I mentioned, and he's very inclusive. But he's also really visionary, and I think with his leaving, he's really set the stage for leaving this college on a very good note and really well prepared for the future. Things I'd like to say to Dean Peterson personally are thank you so much for everything you have given of yourself, the sacrifices you've made. I think I would just like to say thank you for all of your dedication to this college, to all of us, to continue to make this available for students who are coming and a whole new generation of students who want different things from education.
So when he interviewed, I was definitely impressed. He seemed like he was young and vigorous and articulate, and was the kind of person we needed as a leader to do this program. Telepharmacy is something that maybe now we take for granted in the age of Zoom, but it was really kind of a new concept when Chuck started working with that. Again, one of the amazing things about Chuck is he spent a lot of time as a leader for the college, but he also continued doing scholarship too. The effectiveness of telepharmacy in North Dakota is another lasting legacy of Dean. I just want to say, Chuck, thank you so much for everything you've done. You've been a fantastic leader. You've had the respect of all of us. There's no way we would be where we are today as a department of pharmacy practice or as a College of Health Professions without you. You're amazing. Thanks again.
The strengths that Chuck has brought to the college and to the profession of pharmacy and the patients of North Dakota are his mild-mannered, always get her done, even if it takes decades to get something accomplished. And the something could be an advancement in pharmacy practice for the patients of North Dakota, or it could be a building for the students of North Dakota State University College of Health Professions, or it could just be his general faculty and staff. Another perspective that I wanted to bring into some of the things that Chuck has done for our community. The Family Healthcare Pharmacy is a pharmacy that is a federal community health center. The employees at Family Healthcare Pharmacy are NDSU employees. I worked at that pharmacy for 6 years throughout my time as a student pharmacist at NDSU. Chuck was always there to support that practice, to fight for the patients that were very disadvantaged. I learned so much through that pharmacy and that department in patient service, and Chuck's support of that department of the NDSU School of Pharmacy has been huge as well, and a debt of gratitude from those patients as well.
I would describe Chuck as an individual who is a forward thinker, because he always is looking towards something in the future to change things and advance things. And I think you see that by the way the college has grown with so many different departments. He developed a lot of outside programs where students have experiences. He did a lot of that to take the college off campus and to get students out into the community.
I've always been impressed by Dean Peterson. He listens, he's very thoughtful, has great ideas, and is willing to try new things. We came up with the idea that maybe a public health program actually at NDSU with a master's in public health would be a good idea. Results have been resounding, particularly with the COVID that we've experienced and the role that our public health program has put for the state, basically a model for the whole country. If he decides that something is worth working with, he will find a way to get it done. He's supportive of his staff, he's supportive of his students, and certainly his value to NDSU is monumental.
Our entire community appreciates your outstanding vision and guidance throughout your career. You made a positive impact on thousands of students and faculty and colleagues by preparing future healthcare leaders through your work around education and research. Retirement is just a new chapter, and I know, as you've told countless students at many hoodings and pinning ceremonies over the years, once a bison, always a bison. That certainly applies to you as well, my friend. Thank you for your commitment to NDSU.